Hey everyone, it's Dr. Ida Khan. Welcome to our comprehensive video on multiple sclerosis, a complex autoimmune disorder affecting the central nervous system. In this video, we'll delve into every aspect of multiple sclerosis, from its definition, historical background, to its symptoms, diagnosis, treatment options, prognosis, and much more. Now let's begin with the overview. Multiple sclerosis is a chronic autoimmune disease characterized by inflammation and damage to the myelin sheath of the nerve fibers in the central nervous system. It is also referred to as disseminated sclerosis or the encephalomyelitis disseminata. The term multiple sclerosis is derived from multiple scars or the multiple plaques in reference to the lesions that form in brain and spinal cord. Multiple sclerosis is a chronic autoimmune disease that affects the central nervous system, particularly the brain, spinal cord, and optic nerves. Now let's take a look at its background. So, MS has been recognized since ancient times, but our understanding of it has evolved significantly over the centuries, with advancement in the diagnosis and treatment. Now let's discuss about the pathophysiology of multiple sclerosis. So, in MS, immune system mistakenly attacks the myelin sheath. This myelin sheath is a protective covering of the nerve fiber, and when there is attack of the myelin sheath, it leads to inflammation and damage to the CNS. Now, this demyelination disrupts the nerve signals. It means that it would slow down or even stop the nerve signals, and this would cause a wide range of neurological symptoms. Multiple sclerosis is more common in females and it is most commonly diagnosed between ages 20 and 40, but it can be seen at any age. Now let's discuss about the epidemiology of multiple sclerosis. Multiple sclerosis is more prevalent in the regions farther from the equator, suggesting a potential role of environmental factors such as vitamin D levels and viral infections. Mortality and morbidity. While MS itself is not typically fatal, it can significantly impact the quality of life and can lead to complications that may contribute to mortality. Prognostic factors. So, prognosis varies widely among individuals and depends on the factors such as age at onset, disease subtypes, and response to treatment. Many individuals with MS experience periods of relapse followed by remission, where symptoms temporarily improve or disappear. And as I've told you before, that MS is most commonly diagnosed in young adults, typically between the ages of 20 and 40. Now, the frequency of MS, and MS affects approximately 2.8 million people worldwide. MS is a lifelong condition, but its course can vary widely, with some individuals experiencing mild symptoms and others facing more severe disability. Now, symptoms of MS vary widely and may include fatigue, weakness, numbness, tingling, difficulty walking, vision problems, muscle spasms, and cognitive impairment. Symptoms of MS vary depending upon location and severity of each attack, and attacks can last for days, weeks, or months. Remissions and relapses. Attacks are followed by periods of reduced or no symptoms, that is, remissions. Fever, hot baths, sun exposure, or stress can trigger or worsen attacks. It is common for a disease to return, that is, relapse. However, the disease may continue to get worse without the periods of remission. Nerve in any part of the brain or spinal cord may be damaged, and because of this, MS symptoms can appear in many parts of the body. Now let's discuss about the symptoms of the systems that are commonly affected in MS. So first, in the musculoskeletal symptoms, we have loss of balance, muscle spasms, numbness, abnormal sensation in any area, problems moving arms, legs, problems walking, problems with coordination or making small movement, tremors can be there, there can be weakness, facial pain, painful muscle spasms, tingling, crawling, burning feeling in the arms and legs, and fatigue is the most common symptom as MS progresses. It is often worse in the late afternoon. Now, bowel bladder symptoms. So, constipation, stool leakage, difficulty beginning to urinate, frequent need to urinate, strong urge to urinate, urine leakage, that is incontinence. Now, symptoms related to eye are double vision, eye discomfort, uncontrollable rapid eye movements, vision loss, and this usually affects one eye at a time. Now, CNS symptoms, especially of the brain, So, decreased attention span, poor judgment, memory loss, difficulty reasoning, solving problems, depression, feeling of sadness, dizziness, balance problems, and hearing loss. Speech and swallowing symptoms: slurred or difficult to understand speech, trouble chewing and swallowing. Now let's discuss about the types of multiple sclerosis. Multiple sclerosis is a complex neurological disease that can manifest in several different types, each with its own distinct characteristics and progression patterns. Understanding different types of MS is crucial for accurate diagnosis, treatment planning, prognostic assessment. And here we'll delve into four main types of MS. First one is relapsing remitting MS, that is RRMS. It is characterized by periods of relapses followed by remissions. Primary progressive MS, that is PPMS, it progresses steadily without distinct relapse and remission periods. Secondary progressive MS, that is SPMS, it begins as RRMS and then there is transition into a progressive form. Then the last one is progressive relapsing MS, that is PRMS. And this is a rare subtype characterized by steady progression with occasional relapses. Now let's discuss them one by one. So now the first one is relapsing remitting MS, that is RRMS. And this is the most common form of MS, affecting approximately 85% of the people diagnosed with the condition. It is characterized by distinct episodes of new or worsening symptoms, known as relapses or exacerbations, followed by periods of partial or complete recovery, which is called remissions. Now, during remissions, symptoms may improve partially or completely, and individuals may experience long periods of stability with minimal disease activity. Relapses can occur suddenly and unpredictably, with symptoms ranging from mild to severe, and may last for days to weeks before resolving. Over time, some individuals with RRMS may transition to a secondary progressive MS, where symptoms worsen steadily with without occasional relapses. Now, the next is secondary progressive MS, that is SPMS. Now, the SPMS typically follows an initial period of relapsing remitting disease, although not all individuals with RRMS will develop SPMS. In SPMS, the disease gradually transitions from a pattern of relapses and remissions to a more steady progression of disability, with fewer or no relapses. Symptoms may worsen steadily over time, leading to increasing disability such as difficulty walking, fatigue, and cognitive impairment. SPMS can be further categorized into active SPMS and non active SPMS. In active SPMS, disease activity continues to cause relapses or MRI activity, while in the non active SPMS, there is no evidence of ongoing inflammation. Now, the third type is primary progressive MS, that is PPMS. Now, PPMS is characterized by a steady progression of disability from the onset of symptoms without distinct relapses or remissions. Now, unlike RRMS and SPMS, PPMS typically affects individuals later in life, with an average age of onset around 40 to 60 years. Symptoms may include difficulty walking, muscle weakness, stiffness, sensory disturbances, which gradually worsens over time. PPMS tends to progress more steadily and predictably than other forms of MS, making it challenging to manage symptomatically. And now the last type is the progressive relapsing MS, that is PRMS. Now PRMS is the least common form of the MS, affecting only a small percentage of individuals diagnosed with this condition. Now similar to PPMS, PRMS is characterized by steady progression of disability from the onset of symptoms. However, individuals may also experience occasional relapses or exacerbations throughout the disease course. PRMS is often associated with a higher level of disability and faster disease progression compared to the other types of MS. Treatment options for the PRMS may include disease modifying therapies aimed at slowing the disease progression and managing symptoms. It is important to note that while these are the main types of MS, the disease can vary widely among individuals and the progression pattern may evolve over time. Additionally, some individuals may experience atypical forms of MS or overlapping features between different types. Therefore, accurate diagnosis and personalized management are essential for optimizing outcomes for people living with MS. Now, let's talk about the causes of multiple sclerosis. The exact cause of multiple sclerosis is unknown, but it is believed to involve a combination of genetic predisposition, environmental factors, and immune system dysfunction. and multiple sclerosis is more likely if a patient has family history of MS. Now, risk factors for developing MS include family history, certain viral infections, smoking, low vitamin D levels, and living in regions further from equator. Now, diagnosis. So, symptoms of MS may mimic those of many other nervous system problems. So, MS is diagnosed by ruling out other conditions. The doctor may suspect MS if there are decreases in the functions of the two different parts of central nervous system, such as abnormal reflexes at two different times. Diagnosis of multiple sclerosis involves a combination of medical history, neurological examination, imaging tests such as MRI, laboratory tests such as cerebrospinal fluid analysis, blood tests to rule out other conditions that are similar to MS, lumbar puncture, which is also known as spinal tap for the cerebrospinal fluid test, MRI of the brain, MRI of spine. They are important to diagnose and follow MS, and nerve function study, that is evoked potential test. Now let's discuss about the findings on examination. So an exam of the nervous system may show reduced nerve function in one area of the body, or the reduced nerve function may be spread over many parts of the body. This may include abnormal nerve reflexes, decreased ability to move a part of the body, decreased or abnormal sensation, and other loss of nervous system functions such as vision. Now, eye examination may include abnormal pupil responses, changes in the visual field or eye movements, decreased visual acuity, problems with the inside parts of the eye, rapid eye movements triggered when the eye moves. Now, treatment and rehabilitative care. There is no known cure for multiple sclerosis at this time, but there are treatments that may slow the disease. The goal of treatment is to control symptoms, slow disease progression, and improve quality of life. Now, treatment of multiple sclerosis may include disease modifying medications, and now the medications are often taken long term, and these include medicines to slow the disease, steroids to decrease the severity of attacks, medicines to control symptoms such as muscle spasms, urinary problems, fatigue, or mood problems. Medicines are more effective for the relapsing remitting form than for the other forms of the MS. The following may also be helpful for people with MS: physical therapy, speech therapy, occupational therapy, and support groups. Assistive devices such as wheelchairs, bed lifts, shower chairs, walkers, and wall bars. Planned exercise program early in the course of disorder. A healthy lifestyle with good nutrition and enough rest and relaxation, avoiding fatigue, stress, temperature extremes, and illness. Changes in what patients eat or drink if there are swallowing problems, making changes around the home to prevent falls, social workers or other counseling services to help to cope with the disorder and get assistance, vitamin D or other supplement. Patient education. So patients should be educated about their condition, treatment options, symptom management strategies, and lifestyle modifications to optimize their health and well-being. Prognosis. Prognosis varies greatly among individuals and depends on factors such as disease subtype, severity of symptoms, response to treatment. Latest updates. The field of MS research is constantly evolving, with ongoing studies focusing on the new treatment options, biomarkers for early diagnosis, and strategies for improving quality of life for patients. Now, the complications of multiple sclerosis may include mobility issues, bowel bladder dysfunction, cognitive impairment, depression, increased risk of infections, difficulty swallowing, less and less ability to care for self, osteoporosis or thinning of the bones, pressure sores, side effects of medications used to treat the disorder, and urinary tract infections. Now, prevention. While there is no known way to prevent MS, maintaining a healthy lifestyle, avoiding smoking, and ensuring adequate vitamin D levels may help reduce the risk of developing the disease. Now, let's talk about recovery. Recovery from multiple sclerosis varies depending on the individual and severity of disease. Rehabilitation and supportive care can help improve function and quality of life. Now, what to expect? MS is a chronic condition that requires ongoing management, but many individuals are able to lead fulfilling lives with appropriate treatment and support. Now, let's summarize our video by discussing these key points. MS is a chronic autoimmune disease that affects the CNS. Symptoms vary widely and can include fatigue, weakness, and cognitive impairment. Diagnosis involves a combination of medical history, examination, imaging, and laboratory tests. Treatment aims to manage symptoms, slow disease progression, and improve quality of life. Prognosis varies among individuals and depends on various factors. Research into new treatment options and strategies for managing MS is ongoing. Thank you for joining us on this journey to understand multiple sclerosis. I hope this video has provided valuable insights into this complex condition. Don't forget to subscribe to my channel to get more videos. Thanks for watching.